Hello, everyone, and welcome to another session of Health and You, the Community Health and Wellness series. My name is Dr. Amit Abraham from the Institute of Population Health here at Weill Cornell Medicine-Qatar. I'd like to extend a very warm welcome to everyone joining us here today from across the globe. So the overall goal of this series is to try to raise awareness about health and disease. And we aim to do this via enhancing self-care, reducing suffering, improving the quality of life, and increasing healthy longevity. Just a few housekeeping rules before we begin. Your cameras and microphones have been switched off. And so should you have any questions or comments, please do use the Q&A feature. All questions and comments will be addressed at the end of the session. And please also note that this is not a CME or CPD activity, so there will not be any certificates of attendance issued today. So I'd like to now take a moment to introduce our expert speaker, Dr. Sohaila Cheema. She is the Assistant Dean for the Institute of Population Health and an Associate Professor of Clinical Population Health Sciences at WCM-Q. She actively participates in the oversight and implementation of IPH education, research, and community programs. She's involved in teaching both of our pre-medical and medical students. And she's also in charge of the clerkship, where she serves as the associate director. Dr. Cheema is a medical doctor by training, having completed her fellowship in integrative medicine at the Arizona Center for Integrative Medicine, University of Arizona. She's a diplomat of the International Board of Lifestyle Medicine and is a certified lifestyle medicine physician. She has received her Master's of Public Health from Johns Hopkins Bloomberg School of Public Health and is certified in public health by the National Board of Public Health Examiners in the US. Dr. Cheema, we're very excited to hear your session today. Over to you.
Thank you, Dr. Abraham, for that very kind introduction. And I am very happy to be here today with all our participants. And I would like to extend a very warm welcome to all of you joining me today for this session. So I'm just going to go ahead and share my screen. Dr. Abraham, is it okay? Can everybody see my slides?
Yes, we can see your slides and we can hear you well.
Great. Excellent. So I think we are ready to start. And it gives me great pleasure, to be talking about self-care today. So I have nothing to disclose and no financial relationships, and I'm not going to be discussing any unlabeled, unapproved use of drugs or products. So the objectives of today's session are, we'll see what the meaning of self-care is. We are also going to explore some strategies for self-care. And then we are also going to outline how self-care can improve your health, your happiness, and well-being. Now, I thought let's just start by putting things in perspective before we talk about self-care and think about why are we talking about self-care really. So life, of course, we are all living a life. Life is dynamic. We are simultaneously trying to manage a lot of things, a lot of needs, for our jobs, for our families, and many other daily responsibilities. There is really a change which is happening every day in our lives. So we've seen evidence suggesting that 70% of primary care visits, they are due to stress and due to lifestyle-related chronic disease. And we all also know, if things start going wrong, emotional distress can lead to ill health and poor quality of life. People can continue to experience deteriorating physical and mental health. People are living increasingly stressful living conditions. Sometimes there are unrealistic societal expectations. And there appears to be a growing disconnect from realizing their full potential and innate purpose. And we also know that when people are stressed and overwhelmed, they are less likely to engage in healthy habits. The world, of course, is currently facing a silent pandemic of anxiety, depression, other mental health issues. We are seeing an increase in depression among teenagers. Suicide prevalence is also on the increase. And while we are living in the 21st century, right, it's a modern world. We have advanced both medically and technologically. There is an increase in life expectancy, but along with that, we've also seen an increase in lifestyle-related non-communicable diseases like diabetes and cancer and high blood pressure. Now, in terms of behaviors, if we are seeing an increase in sedentary behavior, right? And I'm going to talk a little bit about sedentary behavior because it's very, very important in our lives nowadays. So there's an increase in sedentary behavior, poorer eating habits are being seen. There's an increased intake of fast food and processed food. We are indulging in poor sleep habits. There's substance misuse and an increase in stress. There's also been a tremendous increase in the uptake of social media. And we are really seeing an interplay of psychosocial factors with more competition, time pressure, social isolation, and less intimate engagement with the family unit nowadays. So the question is, why self-care, right? So why should we be talking about self-care now? So of course, as I alluded to, life expectancy has globally increased. So of course, we're going to have an aging global population. Now, the burden of non-communicable diseases is increasing day by day. It's the leading cause of global mortality, right? So it's causing a large number of deaths in the whole world. We are seeing a lot of societal change, which is happening, which is globalization. Again, there's an increase in healthcare spending. Of course, if people are suffering from non-communicable diseases, we all know that there's a huge amount of money being spent if a person has any kind of non-communicable disease, be it diabetes, be it high blood pressure, be it cancer, and so on. There's pressure on the healthcare systems because the burden of disease is very high in the whole world. But also, which is a very important point, that we have now empowered consumers and patients, right? So people want to be engaged more in their self-care. So people want to become partners, with physicians and other healthcare professionals. And basically, they no longer want to be passive recipients, but we are going to see a shift, towards empowering people and consumers, the communities and populations, so that they can try and engage in more self-care. So I'm going to talk a little bit about non-communicable diseases, just so that everybody has a clear perspective on it as to why we are talking about them, why these are very important to address. So if we look at the non-communicable diseases, and again, when I refer to NCDs or non-communicable diseases, I mean cardiovascular, heart disease, respiratory diseases, diabetes, high blood pressure, cancers. So these diseases are actually killing 41 million people each year. So on an annual basis, 41 million people are dying from NCDs. Now, if you look at the percentage out of 100%, 74% of all deaths globally which are happening are due to these NCDs. And another important point is that every year, 17 million people are dying from an NCD before the age of 70. That means it's causing premature death. So if we look at these non-communicable diseases and we look at their risk factors, WHO has described them as behavioral risk factors, as metabolic risk factors, and additional risk factors. Now, if we look at the behavioral risk factors for these NCDs, the non-communicable diseases, we all pretty much are well aware of them. It's tobacco use or other harmful substance abuse, if you're having excess of salt, sodium intake, if you're taking in excess of unhealthy food, if you are taking, again, excess of alcohol, and then if there is insufficient physical activity. Additional risk factors are stress, poor sleep habits, loss of social connectedness, and healthy relationships that I also alluded to as we live in this modern 21st century. And then when we engage in these behavioral risk factors, which are lifestyle related, for many, many years, our bodies try to resist the changes, but ultimately gives up. And, it manifests basically into metabolic risk factors, which, are basically, there's an increase in blood pressure, people become overweight and obese. They cannot, maintain their blood glucose levels. The blood glucose levels become very high, and then, or there are very high levels of fat circulating in their blood. And that ultimately then converts into the diseases that we see, which is diabetes or cancer or high blood pressure and so on. So if we look at these chronic diseases or the non-communicable diseases, they are largely preventable. So I just share some data from these two large population-based studies. These were the Nurses' Health Study and the Health Professionals Follow-Up Study. This has thousands of participants in the study. So these are population-based, very strong, powerful studies in which they actually follow people. And what they saw in these studies was that if people practice 5 specific lifestyle habits, it dramatically reduced their risk of heart disease and cancer compared to those who did none of these things, okay? So what are those 5 habits? Again, if they ate a diet high in fruits and vegetables, whole grains, unsaturated fatty acids, and low in red and processed meat, reduced intake of sugary drinks, trans fats, and sodium. They did not smoke. They got at least 3.5 hours of moderate to vigorous intensity physical activity every week. And if they drank, so very moderate amounts of alcohol, no more than 1 drink a day for women and 2 drinks for men. I do want to clarify now that now very strong evidence is coming out that basically we should be avoiding alcohol. It doesn't bring you any kind of health benefit. So I just wanted to put it out there. But anyway, just related to this study, they just saw that if they drank moderate amounts of alcohol and they maintained a healthy body mass index in the range of 18.5 to 24.9, then what they did see was that basically from the age of 50 onwards, it extended life by more than a decade. So a decade is 10 years. So if you compared with practicing none of them, so if we look at women who didn't adopt any of the habits, they lived to an age of 79. But if they adopted the habits, they lived to 93. And in the same way, if we look at men, if they did not adopt any of the habits, they lived to 75 on an average. And while those who did, they lived to nearly 88. So you're seeing that your life is extended by more than a decade if we just try and address some of the factors that I've alluded to earlier. So let me ask you this. What does self-care mean to you? So if you don't mind, if you can just put in the comments, just put it in the comment, please. And Dr. Abraham, maybe you can just read them out for me if you don't mind. So I'm just asking y'all to try and see what your understanding of self-care means. So it's a term, of course, that we know it's referenced now more often. You will see it in magazines and newspapers and talk shows, social media posts. So let's see, please, what you think self-care means. So you can just put your answer in the comment and Dr. Abraham will be able to see it. Dr. Abraham, can you just read them out to me if you don't mind?
For the moment, no one has put anything in, but let me say what I think self-care means. I would say something along the lines of what steps do I need to follow? What are the things that I myself can do to try
Mhm.
and enhance my well-being, my quality of life? How do I identify what are these steps that I can follow?
Okay, great. Thank you for sharing. So please, may I ask our attendees if you all can just put in a comment, in the chat or even in the Q&A if you want. You can post it there. You can post it as anonymous. What does self-care mean to you?
So we have one person who has said management of personal health.
Okay, personal health.
If anybody else has any comments, self-care is giving time to oneself.
Okay, giving time to oneself. Yes, absolutely. Okay, I think I'm just going to move on. So, what does self-care really mean? So, people actually often think that self-care has a very narrow connotation, referring, to things that you do to pamper yourself, like, oh, maybe I want to go for a massage or get a facial done, or I want to treat myself to a manicure. But just remember that self care can be the general health decisions that most of us make about exercise, about healthy eating, about good hygiene, about self medication, trying to avoid any health risks such as smoking and excessive drinking. It also really involves, taking care of minor ailments, long-term conditions and rehabilitation. So if anybody has diabetes or high blood pressure, how are you really engaging, to look after yourself with that disease? And individuals can perform self-care alone, or they can get support from their next of kin or any other professionals also, such as service and healthcare providers. So just think of it as a comprehensive approach, okay? So self-care is also reliant really on an individual's awareness of their own physical, mental health, and also including awareness of their current health status, right? What is my blood pressure reading? What are my cholesterol reading? And if there you need to go for regular health screenings, then that is what you need to be doing. Self-care also really involves engaging in regular physical activity, such as moderate levels of exercise, eating a healthy, nutritious diet with appropriate caloric intake, and having good hygiene, including proper dental care. In addition, we also include effective self-care. It includes avoiding and mitigating really potential health risks, such as eliminating, again, tobacco use, limiting alcohol consumption, receiving your vaccinations in a timely manner, and as well as using products, services, diagnostics, and medicines rationally and responsibly, right? So it has a very broad meaning. So it basically refers to all those activities which are performed with the intention of improving or restoring health and well-being, as well as treating or even preventing disease. And like I said, it's not only that you're thinking, oh, I can only get self-care from myself, but you can ask for professional help as required, or from people who live around you, your family, your next of kin, your friends. You can also engage them in your own self-care. And I've already given you examples about that. So it's a holistic approach really to better health that focuses on a much broader set of practices that will serve you well over the long run. But it does not mean that we cannot enjoy smaller day-to-day pleasures as they come along. It's very important to understand that when we savor the good things that happen to you, that is also an important ingredient of happiness. Now, I wanted to show this figure, and basically self-care has been described as existing on a continuum. So you can see that it's not static, right? So it's based basically exists on a continuum with purely self-initiated activities such as preventive healthy lifestyle choices on one end. Here you can see that, and on one end, and then the treatment for acute minor ailments and maintenance therapy for certain chronic conditions on the other end, right? So it's really existing as a continuum. It's not in any one phase of our life. I also wanted to show you this, that in managing, in addition to managing certain chronic conditions, self-care, including self-medication as needed or as required or as appropriate, it can really help to, shift the burden of treating minor ailments, where people are just reporting to general practitioners or healthcare practitioners. We can, maybe go to the pharmacy, and there we have licensed pharmacists and become good consumers, and we can take care of those minor ailments ourselves. So you can see, if you engage in self-care, look at the costs. The costs for self-care are very less, right? So this is, again, an important thing, that it's going to help reduce the costs if we need to take care of ourselves. Now, I'm going to focus on the basis of self-care, because the basis of self-care really lies in lifestyle medicine. Lifestyle medicine, it's an evidence-based approach to disease prevention and treatment, and it focuses really on adopting healthy lifestyle habits. There's a large body of emerging evidence of how a healthy diet, physical activity, adequate sleep, managing stress, and strengthening social relationships can contribute to not only disease prevention and longevity, but also disease reversal in some chronic diseases. So if we look at the definition of lifestyle medicines, it's the use of whole food, plant-predominant dietary lifestyle, regular physical activity, restorative sleep, stress management, avoidance of risky substances, and positive social connection as a primary therapeutic modality for treatment and reversal of chronic disease. So I'm going to just discuss now these 6 pillars that we have of lifestyle medicine, and we'll take each pillar, and I'll give you some tips on what good nutrition is, on what good physical activity is. I'll give you some tips and strategies on how you can improve these different pillars, and then you can go ahead and set your goals for self-care. So we'll talk about nutrition first. So in nutrition, of course, your aim should be a healthy diet, right? Now, the challenge is sometimes for a lot of us putting new dietary habits into practice. I'm going to talk about habit forming a little bit towards the end of the session. So for now, of course, we all know that it's really a challenge. If you're really used to something, we have a habit, it's very difficult for us as humans, to move towards change. But we'll talk a little bit more about how we can change our behaviors. Now, what is the right way to eat? That's the next question that comes to diet, right? So the answer is this: there is no one perfect diet which is available for you to follow. So every person is unique, so you need to follow a diet which resonates with you, which sits well with you. What I will share with you are some guidelines. So this is a healthy eating plate, just to give you an example. And this is from Harvard Medical School. And if you look at the plate, this is what it means. So you're going to divide the plate into 2 halves. And then the 1 half, you're going to say, okay, the 25%, I want to eat whole grains, a variety of whole grains, whole wheat bread, whole grain pasta, brown rice. You're going to limit refined grains, which is white rice, white bread, white pasta. All of the whites you're going to try and limit, right? We want to focus more on whole grains. You want to focus on healthy protein. And what we mean by that is choose fish, poultry, beans, nuts. You want to limit meat and cheese and avoid bacon, cold cuts, and other processed meats. And then for the 50% of the plate, you want to fill it up with vegetables, 3/4, and also 1/4 with fruits, right? So for fruits, eat plenty of colors. Vegetables, of course, the more variety you eat, the better for you. Of course, potatoes and French fries don't count as vegetables, but you can certainly have them as a treat. And then use healthy oils like olive oils, canola oil on salads at the table. You want to limit butter and avoid trans fats completely. For water, for a drink, you want to drink water or tea or coffee with little or no sugar. Some plates will tell you have dairy. Some populations, dairy doesn't agree with them, so they may tell you not to have dairy. And of course, we avoid sugary drinks. So this is just like, it gives you an idea of what a healthy plate or healthy dietary pattern should look like. This is my plate for older adults. Again, you'll see that it follows a similar kind of pattern. Fluids, grains, we have dairy here, we have protein, we have herbs and spices, which are a fantastic way, to increase the flavors of foods. You want to do the healthy oils, fruits and vegetables. One important thing that you have to note as you get older is that your caloric need, it typically decreases after age 50. So if your caloric need was maybe 2,500, it'll maybe reduced to 2,000 calories, or for women, it could be 1,500 or 1,600, depending on your physical activity again, right? But your vitamin and mineral requirements, they stay the same, or they may even increase. So sometimes it's a challenge to get the nutrients from a smaller caloric intake in older adults. I wanted to share the Qatar dietary guidelines for those of you who are not aware. Of course, here you can see a similar kind of plate. They've put it as a pearl, the shell of the pearl, because Qatar is known for pearl mining. So again, you'll see fruits, vegetables, grains, the dairy, whole grains, the legumes, and all of that. So what were the key recommendations in the Qatari dietary guidelines? That you eat healthy choices from the 6 food groups, which are vegetables, dairy, milk, legumes, whole grain, fish, poultry, and meat. You want to maintain a healthy diet. You want to limit sugar, fat, and salt, be physically active. You want to drink plenty of water, adopt safe and clean food preparation methods, eat healthy while protecting the environment. And then they also talk about breastfeeding and to build model healthy patterns for your family. This again is a plate from the American College of Lifestyle Medicine. Again, fruits and vegetables, drink water, whole grains, plant-based protein. So what you see really predominantly in these diets, what do they really have in common? So you'll see that they are high in plant-based foods, right? Fruits, vegetables, nuts, seeds, legumes. They encompass a wide variety of foods in all categories. Now, this is very important because people tend to, go on fad diets, which diets become very fashionable. Today it's one diet, next day it's another diet. It's important for us to enjoy a wide variety of food, okay? So we also should favor lean protein, right? You want to remove the fat when you have poultry, chicken. Tofu is a example of good protein, fish. And then you want to eliminate or limit processed meats such as bacon and sausages and hot dogs. And I'll share a slide on that because these items can basically cause a lot of inflammation in our body. And inflammation, again, forms the basis of, all these non-communicable diseases. You also will see that in these healthy diets, we want to eliminate or limit sweets, refined carbohydrates, all the white bread, the white rice, and the highly processed food. So a lot of products that you see on shelves in the supermarkets, they are very processed because you can see that they stay on the shelves for a very long time. So a lot of chemicals and additives have been added to them to increase their shelf life. So they are highly processed food. And of course, include little to no alcohol. Also, this is very important, that it's not necessary to eliminate any food item or conform really to a single dietary pattern to achieve a healthy dietary pattern, right? It should be tailored to meet the individual's health needs, the dietary preferences, and cultural food traditions. And moderation and flexibility is key. This is extremely important because all of us are very unique, belong to different nationalities, different cultures. And for us, all of us, food has a different meaning. So it's very important for us to relate to the food that we are eating. Otherwise, it doesn't really serve a purpose for us. Now, if we look at the benefits that diets have, which are rich in whole plant foods, there are many, many benefits. So again, I'll just review these here. There's decreased risk, even reversal for any kind of heart disease that you may have. Weight loss, there'll be favorable changes in your lipid profile, the fat that you have. Then there'll be decreased risk of diabetes. You'll have good control of your blood sugar levels. There'll be decreased risk of some cancers, reduced markers of early stage biopsy proven prostate cancer. You'll have improved migraine symptoms. Now, these whole plant foods, they are nutritional powerhouses. They have a lot of minerals, a lot of nutrients. They strengthen your immune system. They reduce the inflammation, which is basically otherwise the other processed foods and high-fat foods, which contribute to heart disease and arthritis and cancer. There's also a huge benefit for mental health disorders, and I'll show you a couple of slides on that. Then they are high in fiber, so it really improves your gut health, helps you feel fuller for a longer period of time. It decreases the all-cause mortality, and numerous other benefits. And new studies are coming out every single day, so regularly coming out. Diets high in whole plant foods, they have large amount of health benefits for us. Now, foods that increase inflammation are these. So processed grains, the flours and sugar, why? Because they are high glycemic index. And what high glycemic index means, so glycemic index really, what they do is they assign a numeric score to a food, and it's based on how drastically it really makes your blood sugar rise, okay? So foods are basically ranked on a scale of 0 to 100, with pure glucose or sugar is given a value of 100. So lower the food's glycemic index is, the slower the blood sugar rises after eating that food, okay? Then also these processed grains and sugar, they lead to increased insulin production, the refined carbohydrates, and they're found again in a high percentage of these packaged foods. Processed meat and red meat, you want to avoid all of this because again, they lead to a high amount of inflammation in our body. In the same way, the harmful fat are the trans fats, they are processed oils, oxidized fats, which are products of oxidation formed by heat and rancidity, and then the solid fats. So any kind of fat that you see which is solid at room temperature, the lard, the butter, the meat, the dairy, the tropical oils, so these are harmful fats. So you want to try and avoid these. So we wanted to look at the role of diet and nutrition on mental health and well-being, and I alluded to this. So we already know that nutrition has been implicated in behavior, mood, and in the pathology and treatment of mental illness. Nutritional psychiatry is really a rapidly emerging field of nutrition and mental health. And in the last decade, there's been a steady increase in epidemiological studies, which are investigating the relationship of dietary patterns and mental states. So what they've seen is that the more one eats a Western or highly processed diet, the more you are at risk of developing psychiatric symptoms, specifically depression, anxiety. And the more one eats a Mediterranean style diet, the more one is protected from developing a mental disorder. And again, the Mediterranean style diet is, you can see the picture here. It's basically a very healthy dietary pattern that we've already alluded to. So a lot of plants, fruits, vegetable, nuts, and fatty fish. So what are some strategies for improving your diet, right? So you want to know what those strategies are. So you should try and avoid or reduce red meat in your recipe. And what you can do is substitute beans, fish, skinless chicken breast, or tofu for red meat in your recipes. If you're making a side dish, then it should be vegetables, right? Even when you order at restaurants, try and order vegetables on the side. Use low-fat or non-fat dairy products or unsweetened non-dairy milks. And those include like almond, cashew, or soya instead of whole milk. You want to season your foods with garlic or onion or lemon, and spices rather than salt. Try and buy a fewer packaged foods, so try and shop. If you go to these big supermarkets, the hypermarkets, try and shop at the perimeter, at the outer edges of the store where the whole foods are. Try and avoid the aisles because that's where you find a lot of the packaged and processed foods. Of course, we want to avoid sugar sweetened beverages, soda, and instead you can try and drink tea, a herbal tea, or flavored water with fresh fruit and things like that. So read your food labels. Again, that's a very important strategy that you can use. Read your food label. If you don't know how to, spend some time learning how to read food labels. And try and buy healthy snacks, instead of like cookies and crackers, and keep them with you. So if you feel hungry at any point in time, then at least you have them close to you. If you're eating sandwiches, you can, top your sandwiches with vegetables, and try to do that slowly so that, your taste buds get used to that. And also people complain about, oh, I don't have time for cooking. So you can go ahead and cook ahead, like on the weekend. So it'll help you manage your time and everything. So how do you set your goals? Like if you look at your diet, think about this. How would you assess your diet? Are you eating too many late night snacks, too much sugar? What are some strategies you can adopt for small wins? Can you look for some new healthy recipes? Can you just add maybe one vegetable, to your diet? So look for very, smart goals, which are achievable, which are realistic, and start small. Let's move on to physical activity. Now, the evidence tells us clearly that people are not participating in sufficient physical activity. The levels of insufficient physical activity are increasing worldwide, especially in high-income countries, and worldwide, women are less active than men. So when we talk about physical activity, basically, it's any kind of bodily movement that is produced by the contraction of our skeletal muscles, and it increases energy expenditure above a basal level. Then exercise is really a subset of physical activity. It's planned, it's structured, it's repetitive, right? And then fitness is the ability to perform one's daily activity while responding to emergencies and even enjoy leisure time. So fitness comes as a result of exercise. Deconditioning happens when consistently, if you're physically inactive and lacking exercise, all of this will result in functional loss. Sedentary behavior, I did want to specifically talk about this because it's very important. It's a distinct class of behaviors like sitting, watching TV, driving, and it's really characterized by very little physical movement and low energy expenditure, okay? So like in sitting or reclining position for very long periods of time. So we are becoming more and more sedentary in our lives. So it's very important for us just to stand, be engaged in any kind of movement. And remember that now sedentary behavior is independently a risk factor, for a lot of diseases. So it's very important for us, even if you're doing your 60 minutes of exercise, it's very important for us to keep moving more and sitting less. So what are the physical activity recommendations for children, adolescents, and adults? I'll just go through this quickly. For children, you can see this is between 5 and 17 years, at least 60 minutes a day of moderate to vigorous intensity physical activity across the week. On 3 days a week, they say vigorous intensity aerobic activity, as well as strengthening your muscles and bones should be incorporated. And they very clearly say that we should limit the amount of time spent being sedentary, okay? Then for adults, this is from ages 18 to 64 years, all adults should undertake regular physical activity. So at least 150 to 300 minutes, moderate intensity, aerobic physical, or 75 to 150 minutes of vigorous. And then for additional health benefits, we want muscle strengthening. You limit your amount of time spent sedentary, and you replace with more physical activity of any kind of intensity. So even for adults 65 and older, they should undertake regular physical activity, okay? So it's similar to what the adults do. And then they also say on at least 3 days, varied multi-component, because of course, as we know, we want to increase our functional, balance and strength as we become older. Now, the question that you might ask is, what is, moderate intensity? What is vigorous intensity? So you can just see here, moderate intensities like brisk walking, tennis, recreational swimming, riding. Vigorous would be where you are really increasing your aerobic activity. So football, volleyball, basketball, swimming, jogging, running. And then bone and muscle strengthening are these kind of activities: climbing trees, tug of war, dancing, field athletics, jumping rope, right? So what you can also easily do is, if you think of light activity, that's just normal breathing. You can do light activity and your breathing remains the same. If it's moderate intensity, breathing gets faster. You can carry on a conversation, but you're not going to be able to sing. And then vigorous, of course, is you're really gasping for breath and you are not going to be able to hold a conversation. So please remember, of course, for different special people and special groups of people, there are different physical activity guidelines, and you can talk to your healthcare physicians. And of course, the World Health Organization also has guidelines on these. Now, the different categories for physical activity are, the aerobic, we already spoke about that, strength and resistance activities, flexibility, and balance. So these are the 4 components if you think about physical activity. Now, all of these different components have many benefits to our health, right? So there's decreased risk of all-cause death, decreased risk of cardiovascular new cases, cancers, increase in the quality of life, increase in sleep quality. Then also resistance training is going to reduce your injury and your fatigue. It's going to increase your basal metabolic. Again, same, improve sleep, performance, muscle strength. It's also going to help reduce risk of falls in the elderly. Flexibility and balance training, they also have a large amount of benefit for us. From falls, it reduces injuries resulting in medical care. It also decreases the falls resulting in fractures. I also wanted to emphasize that just by engaging in physical activity, sufficient physical activity can actually prevent 13% of breast and colorectal cancer, 8% of diabetes, 7% of heart disease, and 1 in 10 premature deaths. Physical activity has also been used as an aid in the management of or an adjunctive treatment for all these different kinds of diseases: cancer, renal disease, sleep apnea, osteoarthritis, high blood pressure, heart disease, type 2 diabetes, and obesity. Now, of course, the benefits of physical activity for adults and children both are manifold, right? So you may have immediate benefits, you have long-term benefits, and it ranges, from better quality of sleep, less anxiety, good blood pressure, your brain health increases, your heart health, cancer prevention, healthy weight, bone strength, balance, and coordination. It also is a proven mood booster, increases energy, keeps your muscles, bones strong, keeps you limber, lubricates joints, helps control weight, and enhances your immune system. If we look at the physical activity in children, again, manifold health benefits, from cardiorespiratory and muscular fitness to good, cardiometabolic health, bone health, cognitive outcomes, very important in children, of course, mental health, reduced adiposity, and maintains a healthy weight. Now, if you look at this diagram, it shows you if you have physically active children, they will do very well. And the likelihood in the adults is that they carry these, basically behaviors with them. And basically they do very well even in the adults. So the outcomes are much more better for health if children are physically active. So strategies to help you move more: make time. You have to make that 10 minutes, 15 minutes. You're watching TV, sit on the sofa, enjoy, find joy in the exercise or movement that you do. Set your alarm if you think you're going to forget about exercise or moving. Just put the alarm clock on. Do one active chore, do laundry, do vacuuming, do gardening, whatever it is. Maybe call in a friend, go for a walk together. While you're microwaving, just march in place. So you can do small steps to really get moving more. Here are just, several ways that you can get moving at home. Read standing up, just move your arms, stretch your arms, you do some jumps. Again, run in place for 30 seconds, do mounted climbers. So it's not that you have to go and buy an expensive gym membership. There are several ways of just moving at home. There's so many online free classes available now for exercise and movement, which you can really, just join at any time at your leisure time. Set your goals. How many days a week do you exercise? For how long? If time was not a problem, how often would you work out? Can you make time in your schedule? What activities do you enjoy? Can you build more movement in your daily routine? And what long-term or short-term benefits of exercise really appeal to you? So moving on to sleep. Are we sleeping enough? That is a million-dollar question. So sleep is really underrated. We spend about 1/3 of our lives asleep, and that might seem like a colossal waste of time, but sleep really serves several important purposes. It's very essential. It's required for health optimal functioning. It's not a passive process as it appears. So basically, there's a lot of housekeeping which is happening inside your brain and body when you sleep. Your hormones that regulate metabolism, they're secreted. The immune system surveys the bodies for potential problems. Tissues are repaired. Waste products are removed from the brain neurons, and so on, right? So brain deprivation, as you may know, it's a form of torture. So we need to get good 7 to 8 hours of restorative sleep. It's very important for us. If we don't sleep, it affects our health, right? Chronic health problems increase, like obesity and diabetes and high blood pressure. Insufficient sleep can also make you, tired. So you are not going to be able to work efficiently. Your productivity is going to be less, and you will engage in drowsy driving. Your immune system is likely to go down, and again, your blood pressure might increase. You're more prone to depression and anxiety. So what can you do to improve your sleep? Create a sanctuary in your bedroom. Your bedroom should be only for sleeping, right? Keep your electronics out of your bedroom or far away from your bed at least. Avoid caffeine and alcohol, at least 3 to 4 hours before going to sleep. Try to go to sleep at the same time each night, and do something calming before you go to bed. It could be a bath, it could be having some chamomile tea or whatever it is. And at night, you should just eat a moderate sized dinner. Don't try and eat heavy meals. You should try and get outdoors in the morning. You should limit your daytime naps. And if you can't sleep, the advice is that don't just watch the clock. Just get up, do something else, do something calming, and then come back and try and go to sleep. So again, your goals: how many hours of sleep do you get? Do you feel refreshed or not? Do you just keep lying awake at night? What do you typically eat or drink? Try and change even one small thing and see if that makes sleep better for you. Social connectedness. Now, social connectedness, we all know, right? We are wired for social connections. And because of that, social isolation, the associated loneliness, it causes a lot of health conditions and health issues for us. So social connection is really a well-established determinant of mental, emotional well-being, physical health outcomes, and longevity. So we know that it's a positive subjective evaluation of the extent to which where we have these meaningful and close constructive relationships with other individual groups or society, right? So it's very important that we have feelings of carings about others and feeling cared about by others, such as love, companionship, affection, and feeling of belonging to a group or community. And the opposite, of course, is loneliness. So it's a risk factor for all these conditions like depression and low self-esteem and poor life satisfaction, reduced hope. But social connectors is a basic human need that we all need. So please remember, social relationships, people have seen if you have poor social, it can lead to all these different health issues like heart attacks and atherosclerosis and high blood pressure. So extremely important for us to stay connected, right? People who have strong social connections, they are 50% less likely to die prematurely, okay? So it's very important for us to maintain and foster good quality connections. And how can we do that? The first thing is like if you cultivate your mindfulness, right? You train your mind to focus, you pay attention to the present moment. And mindfulness does not mean that you don't look at your negative experiences. So you are open fully to both pleasant and unpleasant experiences, right? So this helps us to basically deal with adverse events. Then mindfulness is really the first step in emotional healing. So we are able to acknowledge our difficult thoughts and feelings, and this helps us towards the moving towards healing and emotional well-being. So being genuine, what does that mean? That you speak and react honestly, right? That there's no fakeness in it. Communicating affirmations, it's just you're searching for the positive core in the other, emphasize the positive, focus on positive aspects of life. You want to acquire resilience and develop that ability to bounce back. Effective listening, of course, where I show empathy, I'm active, I'm focusing on the speaker's agenda. So this will all foster quality connection. And then, of course, supportive communication, which means I'm non-judgmental, providing direction and guidance and not criticism. Again, setting your goals for social connections. Do you have people in your life who support you, give you strength? Can you spend some more time with them? Do you make time to connect with friends or family? How healthy is your relationship with your children, your spouse, your best friend? Do you have a pet that you care for? Or is there a group that you can join? Moving on to stress. So now, of course, stress we know is ubiquitous, in life, and it's unequivocally related to poor health outcomes. So it's important to qualify really that stress, however, is not necessarily negative all the time. So this is really, a little stress curve that we tend to follow. So we can have good stress and bad stress, so different stresses can affect your performance. If there's too little stress, then maybe you're not motivated. But if, the stress increases, you rise to the challenge, but up to a certain point, right? Because if that stress continues for a long time, then it will lead to burnout. So we don't want to reach this stage, of course, right? So yes, there's good stress and bad stress, and we need to recognize that point where too much stress is too much stress. So steady stress, it can again manifest in the human body as a headache, backache, frequent illness, gastrointestinal problems, high blood pressure, difficulty sleeping, and then moving on to diseases like coronary artery disease, asthma, rheumatoid arthritis, heart failure, psoriasis, mental illness, specifically anxiety, right? And also significant slower wound healing. What we want to develop is really resilience. Your resilience, it's the ability to cope and to recover from setbacks or stressful situations. And your resilience is really determined by many dynamic interactive factors. And it also includes your genes, your childhood experiences, and your social environment, which is again turned by your culture, economics, politics, among other things. So growing up in a loving family with parents, friends who are supportive and emotionally responsive and reliable can really help you with resilience. So how can we boost? Of course, exercise, good sleep, social connections. We've already spoken about this. Attitude, basically in attitude, what we do is we reframe our thoughts, right? We move from the negative, we restructure, and we develop more a positive sense. Having a sense of purpose, practicing gratitude, being thankful for the blessings that we have in life, emphasizing the positive, forgiving others, self-compassion, which of course self-care is also there. Practice kindness. It doesn't take much. Even a simple smile is, practicing kindness. Learn to forgive and forget and to move on. And stop beating yourself. If an error happens, something goes wrong, it's okay. We are all human. What are some strategies again? We've alluded to these earlier, but you will see again, if you practice mindfulness, exhibit gratitude, be flexible, you want to elicit, the relaxation response in anything, whether it's exercise, whether you meditate, whether you go for a walk, help other people, cultivate optimism, develop positive relationships, get good restorative sleep, cognitive restructuring, the power of nature. They've seen that if you take a walk in nature, go sit next to the seaside, very powerful for us for relaxation. Practice forgiveness and openly communicate. Again, setting your goals, reframe the sources of stress in your life. What do you do to calm yourself? Take a moment to put things in perspective. Can you take 10 minutes maybe to do meditation or go for a walk? These are some goals that you can set for yourself. Moving on to smoking and addictive substances. Of course, I don't have to go into the detail of what the deleterious health effects of smoking and addictive substances are. But for those people who live in Qatar, I did want to share with you this resource at the Tobacco Control Center at Hamad. All services are provided free. Also, other services are provided at the primary healthcare clinic. So if anybody needs help with quitting tobacco and any other product related, please go to them. They are doing a fantastic job. They'll come up with a follow-up plan. They really look after you well and will help you with smoking cessation. So there are many smoking cessation clinics at Hamad, so Tobacco Control Center, Al-Wakra, at Hazem Mubarak, Al-Khor, and in the near future, they'll also come up in the Heart Hospital and National Service Academy. So it's never too late to quit smoking or any kind of tobacco product. For people who are suffering from substance abuse, mental health services, I just wanted to mention these are available in Qatar and through Hamad Medical Corporation Mental Health Service. And they have many different kinds, from child to adult to older adult, women's health, forensic mental health. And these can be provided here. They are provided at primary healthcare, Sidra, Nofer, and also in the private sector. And there are many referral pathways, through the emergency, through health clinics, where you can access all these substances, because addiction is a huge problem. We cannot deal with it generally on our own. We need help. Now, self-care strategies for success. So what you try and do is think of it like an experiment. Make that change, whatever you want to achieve, it should be reproducible. The very important thing is write up your list of reasons to make the change, right? And you post it somewhere, whether it's on the fridge, on your mirror, or wherever it is. Recruit your team, if it's your family, your husband, your daughter, your son, your friend, that's your team. They are going to help you engage in self-care. We are normal and human, so expect lapses and chart your progress. It'll help you in the long run. I'm just going to talk about motivation and habits a little bit, because these are important components to self-care. So motivation is really, that process that will initiate, guide, and maintain goal-oriented behaviors. Okay. So if you want to try and lose weight, for example, you want to try and get that promotion, what is it that is motivating you? Now, if we look at the components of motivation, there are three. Activation, which is your decision to initiate the behavior, then persistence, where you do a continued effort toward that goal, and then the intensity, the concentration and vigor that goes into pursuing that goal. And motivation can be extrinsic. Basically, it arises from outside of the individual. Often it'll involve external rewards. Maybe I'll get a trophy, maybe I'll get social recognition or praise. And there is intrinsic, right, which is internal, and it arises from within the individual. So, which is self-efficacy, what is the interest, the enjoyment. Self-efficacy really, it refers to an individual's belief, right, or his or her capacity to execute the behaviors necessary to produce the specific performance attainment that you want to achieve. Motivation is important, right? Why? Because it increases your efficiency, it'll drive you to take action, it'll encourage you to engage in health-oriented behaviors, it'll help you to avoid unhealthy or poor behaviors such as risk-taking, addiction, and it'll help you feel more in control. What are the tips? Adjust your goals and to focus on things that really matter to you. If you're tackling something too big, break it down into small, manageable steps, improve your confidence, improve your skills, and remind yourself, what you've achieved in the past and where your strengths lie. And then if there are things that make you feel insecure about anything, then work on making improvements in those areas. Be mindful. What are the causes of low motivation? All or nothing thinking. It means that you have to be absolutely perfect when you're trying to reach your goal. So that can lead to low motivation. Then believing in quick fixes. So please, there is no quick fix. And then thinking that one size fits all. Just a few more slides on habits and we'll finish. I know we're at 5 o'clock. So habits, again, we all know, we are creatures of habit and they're a major part of our everyday routine. And habit formation happens, we acquire habit, by experience, we repeat that behavior. So then it becomes fixed, then it's fully acquired, and then you end up performing it automatically. And then habit becomes a sequence of action that tends to occur in response to a particular situation or cue. Now, habitual cues, there are external, which could be, anything, right, from the environment, or it could be internal. Internal cues are like the mood, thinking patterns, sensations in the body, and so on. And habits, they're really key to health and self-care. So how change takes place, it generally goes through all these 5 different phases. But again, where you are probably not thinking about making that change, you start thinking about the change, you start preparing where you want to put that idea into action, then you actually do the action, and then you maintain it, and it becomes a habit. So just some last key messages. Please remember, self-care, it's characterized by healthcare consumers like you, me. We want to take a proactive role in identifying, managing health conditions to optimize really physical health and psychological and spiritual well-being. So self-care, of course, it can, benefit individuals, healthcare systems, and as such society as a whole. So self-care is an act of self-love. What we try and do sometimes in life is we are trying to keep too many balls in the air. But sometimes we reach a breaking point where the balls start to drop. One needs to take a back seat to the demands of others. And you may have heard this on the aircraft, right? Put your own oxygen mask before helping others. If you don't help yourself, you can't help others. Nutrition, follow a healthy dietary pattern. There's no one perfect diet for all. Your food should be the medicine, and our medicine should be our food. Remember that everything you eat or drink is really a chance for you to nourish your body. Keep it simple, go back to the basics, enjoy real food. Physical activity is critical, for preventing, treating chronic diseases, and it's never too late to start physical. Sit less, move more during the day. Again, a quote from Hippocrates, eating alone will not keep a man well. He must also take exercise. The World Health Organization tells us, let's be active, everyone, everywhere, and every day. The key pearl for sleep. The simplest way basically to drastically improve your life is just get more sleep. Get restorative sleep, find that sleep sweet spot between 6 to 8 hours, and again, encourage people and patients to develop a healthier relationship with sleep. So social connections, highly influential for our good health. It's recommended across the life course. We have to remember that. So please encourage social connections wherever you can. Stress management, again, engage in anything that will help you build your resilience. Self-care is really the way forward. Don't wait. The time is now. We must make conscious decisions about well-being. It's up to you to say, I am worthy of more. Remember that self-care is not a destination. It's a journey, and it'll take regular effort to engage in self-care. Our biggest asset is ourself, the human body. So let's embrace healthy, active lifestyles. A gentle reminder, take care of myself today. Don't avoid yourself. Pause, get to know yourself, and let's create that harmony in ourselves. Make yourself a priority. Last slide. So this was just, you can just think and reflect. Think of yourself as a plant or anything else that you would like to think of yourself as. And think about how your plant is feeling today. And how is it that you can nurture your plant? Write down 3 things which you will try and change for self-care. Thank you for listening.
So with that, then I'd like to thank Dr. Sohaila for giving us this interesting talk. And thank you everyone for joining us. Take care, everybody.
Thank you. Thank you, Dr. Ibrahim. Thank you, everybody, for joining us. And please do engage in self-care and look after yourself. All the best to you all.